Welcome, Dr.
Both the
Usha.
previous speakers, Dr.
Dr.
Geeta.
Usha, just to say, it is really humble for you to give opportunity for the other colleagues to say, and you are the last batsman, and Dr. Kanti Bansal is going to win the World Cup. So our last batsman, and she will be speaking on how we manage AN. Madam, the stage is yours.
See, management has already been discussed. I'm going to kind of focus more on the guidelines made by Dr. Durusha under the guidance of Dr. Durusha with multidisciplinary, teams. So basically today I read anyway we know that diabetes, the world diabetic capital is India. And today I read in the newspaper that diabetes is really increasing at a dangerous level. The other important thing I tell ki today we were talking about molecular biology and genomics. But here in Acanthosis nigricans and otherwise also, if you go through the medical books like Hutchinson's Medicine Clinical Disorders, in the first very page itself they say that 80% of the diseases can be just diagnosed by history taking an examination alone. So even worldwide, when you go to England or America, Indian doctors are preferred because they are very good at history taking and clinical examination. Acanthosis nigricans is a clinical manifestation of several underlying chronic conditions, and it presents as chronic acanthosis nigricans. Currently, there are no national or international multidisciplinary guidelines or recommendations for AN. As I already told you, the PCOS Society of India, under the expert guidance of Dr. Durusha, identified AN as a priority area and constituted a multidisciplinary expert working group for review and recommendation, and PCOS Society of India in collaboration with the following societies. It's a very busy slide, so I'm not going to read all the names. You can read it by yourself. Acanthosis nigricans is a velvety darkening of the skin that usually occurs at the intertriginous areas of the skin. This hyperpigmentation has poorly defined borders and occurs mainly at the skin folds like nape of the neck, axilla, groin, and the previous speakers have shown you enough pictures. So then I don't have to go into the details. These patches may also occur at the different sites like elbows, knees, knuckles, lips, soles of the feet. So what is the global prevalence of acanthosis nigricans? It can be anywhere from 7 to 74%. It is more common in Asian population. It continues to be on rise because of the worldwide increase in the non-communicable diseases. It is most prevalent in the adolescents, as we have been talking since morning. And the incidence in the adolescents is almost 61.5%. So diagnosis is very simple. It is by clinical examination. Is usually sufficient to diagnose AN, and it's very characteristic lesion. If in doubt, you can use the help of dermatologist. AN not only manifests as underlying chronic condition, but also pose a cosmetic aesthetic issue leading to depression, loss of self-esteem. Occasionally, you can use a dermoscope to diagnose acanthosis nigricans, but I think it is not needed. And the previous speaker spoke about the Berg's classification to kind of show the severity of the lesion and scale about the severity of acanthosis nigricans. Somehow the dermatologist missed about the differential diagnosis. Simple seborrhea, tinea, erythema, candidiasis, pellagra, ichthyosis, linear epidermal nevus, and other are the differential diagnoses. The first slide shows the example of tinea, and second is ichthyosis, where there is a severe dryness of the skin leading to very scaly patches. So what are the risk factors of acanthosis nigricans? People who are obese. Again, the previous speakers, they spoke about the obesity and high risk of acanthosis nigricans. Pre-diabetic. You will be surprised to know that AN starts 8 to 10 years before the onset of pre-diabetes. So if any patient is walking in your clinic, be it endocrinology, be it general physician, or be it a gynecologist, if somebody has seen a lesion which is acanthosis nigricans, it should kind of stimulate your mind to diagnose insulin resistant. And if at that point of time, we kind of, alter the diet and lifestyle modification, we can actually prevent such person from developing diabetes and its complication in future life. Polycystic ovarian disease in young girls is also like in 27% of the PCOS patients, we do see acanthosis nigricans. And if there is a family history of diabetes, hypertension, again, such patients are at the risk of acanthosis nigricans. Prediabetes is a reversible condition. Early detection is extremely and crucial to prevent further progress. And insulin resistance. Now we have been talking about insulin resistance since morning, and everybody is trying to explain what exactly is insulin resistance. But till date, the definition of insulin resistance is elusive. It is actually an impaired biological response to insulin stimulation on the target tissues like liver, muscle, and adipose tissue. Insulin impairs glucose disposal, resulting in a compensatory increase in the beta cell insulin, leading to hyperinsulinemia. And consequences associated with it are namely metabolic syndrome and insulin resistant syndrome. Causes of acanthosis nigricans, in 85 to 90% of the cases, it is because of metabolic disorders. Most common form of AN is associated with insulin resistance. Severity of the lesions relate to the amount of weight excess. Syndromic type A and B PCOS, which type A is hair end, which has been already discussed. Hyperandrogenism, insulin resistance, and acanthosis nigricans. Type B is also hyperandrogenism with insulin resistance. Genetic disorders have already been discussed. Paraneoplastic, GI malignancies, ovarian cancers, genitourinary malignancies. If you see the picture, this is a Peyer's sign where there is excessive scaling on the hands. The only thing about GI malignancies and cancers is it is very rapid onset. So if somebody comes to your clinic and say कि 15 दिन से मेरे हाथ पैरों में ऐसा हो गया, skin lesions ऐसे हो गए, तो don't think about AN. Think about something beyond, out of the box, because it is malignancy, and if we miss, then it is crucial for the patient. And once the tumor has been removed and the patient has been cured of the tumor, the symptoms, the skin lesions, they sort of resolve. Autoimmune, SLE, Sjogren's syndrome, Hashimoto's thyroiditis, they are associated with acanthosis nigricans. Iatrogenic causes like side effects of certain drugs, insulin, steroids, testosterone, nicotinic acid, and idiopathic causes like acral acanthosis nigricans. Acanthosis nigricans and PCOS. PCOS is basically a state of hyperandrogenism and insulin resistance. Patients present with oligoamenorrhea, anovulation, infertility, hirsutism, type 2 diabetes mellitus, endometrial cancer, then cardiovascular diseases, etc., etc. Pathogenesis, previous two speakers have already discussed, so I'm not going into the detail. Basically, increased circulating levels of insulin, they lead to increase in the insulin-like growth factors 1, which leads to the proliferation of fibroblast, and hence leading to acanthosis nigricans. Acanthosis nigricans and associated conditions, because of this, because of obesity, because of diabetes, because of pre-diabetes, it can lead to hyperglycemia, hypertension, dyslipidemia, hyperuricemia, and prothrombotic state. Investigations, pre-diabetes and diabetes, fasting insulin level. But the thing is, we normally, practically, we don't do fasting insulin levels. Once we know that the patient is PCOS, she has hirsutism, she has acanthosis nigricans, so we don't know what we are going to gain out of doing a fasting insulin level. It is better to do a fasting 2 hours oral glucose tolerance test and HbA1c level so that we can monitor her in future when we are treating the patient. Lipid profile. An investigation of acanthosis nigricans associated with polycystic ovarian disease is oral glucose tolerance test, TSH, because 10% of the patients with PCOS have hypothyroidism or Hypothyroidism itself can present as PCOS, so it is important prolactin level, total and free testosterone level, dehydroepiandrosterone levels, 17-hydroxyprogesterone levels, and lipid profile. Sorry, I forgot to mention pelvic ultrasonography. But the thing is, pelvic ultrasound is also is not a must. If the patient has two of the criterias, Rotterdam criterias of PCOS, so we don't need the third one. So evaluation of acanthosis nigricans and its association, future association. So what we need to do is a proper history and a thorough clinical examination, including the weight, body mass index, abdominal circumference, hirsutism, etc. Important to do a relevant investigations, as I have already mentioned early. In obese female adolescents with clinical signs of hyperandrogenism and irregular periods, they require a complete workup for polycystic ovarian disease. This is the same basic approach. Management, I'm not going to talk in details because diet, lifestyle, multidisciplinary team has been discussed since morning in the panel discussions and individual sessions, so I don't know. Is it relevant to discuss right now? Yoga, meditation, mindfulness is very, very important. This has also been discussed at length in the previous panel discussions. Medications for depression may be necessary in extreme cases, but psychological counseling is very important. Exercise and its role, how to do, how many minutes in a week, what kind of exercises, muscle training, walking, yoga, aerobics, etc., etc. So again, I don't want to go into detail because throughout the day we have been listening to it. Diets and its role has been discussed. So basically the take-home message is patients need to be educated that acanthosis nigricans needs further evaluation. We cannot just ignore it कि हाँ है तो कोई बात नहीं, थोड़ा weight कम कर लोगे, थोड़ा diet वो करोगे तो ठीक हो जाएगा. It's not like that. We also, as gynecologists, we should rule out other causes of acanthosis nigricans like autoimmune diseases. Is it autosomal dominant? Is it because of medications? So when we are taking history, we automatically come to know what exactly is causing acanthosis. But at the same time, we should make sure that we are not ruling out, we are not missing on PCOS. It can be controlled or reversed if the causative factor is removed. Depression and low self-esteem can occur in patients with AN, and therefore psychological counseling should be started very early. So thank you very much, and I'm sure I was finished before time because throughout the day we had been listening to everything. Thanks a lot.
Thank you, Dr.